Everyone, I am Neelu from Nursing Department. We will discuss on hypertension. What is hypertension? Hypertension, also known as high blood pressure, is a long-term medical condition in which blood in the arteries is persistently elevated. The SPP will be more than or equal or 140 mmHg and 80. एंड टाइप्स क्या है इसके? प्री हाइपरटेंशन, हाइपरटेंशन स्टेज 1, हाइपरटेंशन स्टेज 2, प्री हाइपरटेंशन SPP 120 to 139 mmHg एंड DBP 80 to 89 mmHg. और हाइपरटेंशन स्टेज 1 में क्या है? SBP 140 and 159 mmHg and DBP 90 to 99 mmHg. Hypertension stage 2 SVP more or equal to 160 mmHg और DBP more to equal to 100 mmHg. Etiology में क्या है? Primary HTN, it is the elevation in BP without an identified cause. Secondary HTN, it is elevated in BP within exot cause. This type is account for 5 to 10% to total causes. The cause of secondary HTN include renal disease, endocrine disorder like Cushing syndrome, neurological disorder like brain tumor and hand injury, and sleep apnea. रिस्क फैक्टर क्या है? एज, चांस ऑफ CAD आफ्टर 50 years of age, alcohol smoking and diabetes mellitus and excessive dietary intake of sodium, gender, family history. एंड पैथोफिजियोलॉजी क्या है इसकी? हाइपरटेंशन, पैथोफिजियोलॉजी ऑफ हाइपरटेंशन, द नॉर्मल ब्लड प्रेशर इज मेंटेन बाय 4 mechanism: sympathetic nervous system activities and activities of vascular endothelium and activities of renal system. Sympathetic nervous system activities: when the BP is decreased, the activation of SNS will occur. The increased SNS activity increase the heart rate and cardiac contraction. Next है the increase the heart rate and cardiac contraction produce vasoconstriction in the peripheral arteries and promote the release of renin or kidney. And next है the net effect of SNS activation is to increase the arterial blood. Activation of vascular endothelium क्या होता है? The vascular endothelium is a single cell layer that line the blood vessels. Next, it will produce vasoactive substance and growth factor like nitric acid, endothelin, etc. etc. Next है these substance are causes vasoconstriction and cause increased blood pressure level. Activities of renal system. एक्टिविटीज़ ऑफ रेनल सिस्टम में है एंजियोटेंसिन और एंजियोटेंसिस 1, एंजियोटेंसिस 2 और 81 रिसेप्टर, और नेक्स्ट है ब्रेडिकिनिन और बीके रिसेप्टर्स. Activities of endocrine system: when the angiotensin second is stimulated in the adrenal cortex, it will secrete aldosterone. And next है the aldosterone will stimulate the kidney to retain sodium and water. Thus the BP and cardiac output will get increased. Clinical features क्या है hypertension के? Sometimes the high blood pressure does not cause any symptoms, so that it is known as silent killer disease. In some patients, the symptom will develop like severe headache, blurred vision, dizziness, nausea, vomiting, fatigue, confusion, epistaxis and chest pain. Diagnostic evaluation: फर्स्ट है हिस्ट्री कलेक्शन एंड फिजिकल एग्जामिनेशन. नेक्स्ट है मेडिकल हिस्ट्री ऑफ डायबिटीज मेलाइटस एंड कंप्लीट ब्लड काउंट एंड चेस्ट एक्सरे और ECG. मैनेजमेंट क्या देंगे हम पेशेंट को? मैनेजमेंट में है मेनली द मैनेजमेंट ऑफ द हाइपरटेंशन इज पॉसिबल बाय 2 way विच इंक्लूड लाइफस्टाइल मॉडिफिकेशन, फार्माकोलॉजिकल थेरेपी. एंड लाइफस्टाइल मॉडिफिकेशन क्या है? इन विच weight reduction, diet approach to stop hypertension, that called DASH diet. dietary sodium reduction and reduce alcohol and exercise. Pharmacological therapy में क्या देंगे हम पेशेंट को? Various group of drugs are used to treatment of hypertension. Collectively, these drugs are called as anti-hypertensive drugs, which include diuretic drugs. It have the kidney to inhibit the sodium reabsorption is the distal converter tubers, ascending limbs, and beta blockers. Beta blockers में this medication reduce the workload of the heart, the blood vessels, and causing the heart to beat slowly and with less force. Example, atenolol or propranolol. Alpha blockers, this medication cause the peripheral, and vasodilator, this medication acting directly on the muscles in the wall arteries and preventing the muscles from tightening and arteries from narrowing. Example, nitroglycerin or sodium nitroprusside. ACE inhibitors. This group of medication will reduce the conversion of A1 to A2 and prevent. Calcium channel blockers. These medication will block the movement of extracellular calcium into the cell and causing vasodilation and decrease heart rate. Example, amlodipine or verapamil. Or alternative therapies which are helpful to regulate blood pressure include acupuncture, relaxation techniques and diversional therapies. नर्सिंग मैनेजमेंट क्या देंगे हम पेशेंट को? फर्स्ट है प्रॉपर हिस्ट्री कलेक्शन शुड बी डन विच इंक्लूड फैमिली हिस्ट्री आल्सो, डाइटरी हैबिट शुड बी असेस, एंड नेक्स्ट है आइडेंटिफाई द मेडिकल हिस्ट्री सच एज डायबिटीज, CAD, रेनल डिजीज, एंड इंस्ट्रक्ट द पेशेंट टू अवॉइड स्मोकिंग एंड एल्कोहलिज्म. आइडेंटिफाई यूज ऑफ मेडिकेशन सच एज contraceptives, steroids, etc. Monitor vital sign frequently. Provide diet which is low in sodium and rich with fruit and vegetables.